PNC nursing students. Today we are going to make an occupied bed. So I have the bed started already for you. So we have our client, Mr. Jones, who I have already properly identified because he's had his bath today. And I took off the top sheet and the blanket, and I have placed a nice warm back blanket over him to maintain privacy and comfort, and I have donned gloves because I'm not sure if the linens are going to be soiled or not. I have my assistant Shondi here who's going to help me maintain safety. So we have gone ahead and moved the bed up to an appropriate working position for us, and we have put the side rails down again so that we can work around the bed with ease, but we're going to maintain safety so that he doesn't roll out of bed. All right, so Mr. Jones, we're going to have you roll over towards Shondi. So a lot of times with your patients, you can just have them put their leg up like this, bend it at the knee, and then they can kind of help push off with their foot, and they roll over much easier, and it gives them some feeling of control as well. All right, so he's nice and covered. You won't be able to see this for this moment, but when we get to that side, you'll be able to see what I'm doing. So just what I'm going to do is I'm not going to lean over the bed because, again, I'm clean. And you can always put a gown on if you want to, but you usually don't have to. But just loosen up the sheets, and we're going to roll them onto themselves. Remember that cleanest to dirtiest technique. Just roll it like a tube. And tell the patient what you're doing. Provide comfort, and he's going to feel safe because Shondi's here helping to make sure that he stays in the bed. So I have that rolled right up underneath his buttocks. And I have to explain to the patient, you will feel a bump there. And then I'm going to go ahead and put some clean linens down. Now if it was soiled, you could do, we call them blue pads. You could put one of those against the patient just so that the soiled linen does not touch the clean linen. But he is not soiled, so we're not going to do that at this point in time. So we have a clean sheet. Don't come in and start shaking the sheets out like you do at home. We don't want to stir up any pathogens or microbes. So just carefully unfold it. Again, trying to keep yourself away from the sheets as best you can. Tuck those corners on. And your goal is to make sure that you don't have a lot of wrinkles in the bed, because those can again cause pressure points on the client. Now I'm going to roll this, and I'm going to tuck it right up under the sheets that are already there. And when we when we have him roll over, I'll be sure and have Shondi show you how we've got that tucked in there really nice and tight. Okay, next is our draw sheet. This helps us move the patients up and down in bed. Again, don't be flopping it around too much. I think I'll go this way with it. We'll go short. You can go long with it or you can go short, but he's able to help us in bed. And again, I'm rolling it. I'm going to hold it up so I can show you. I'm rolling it. And then I'm going to tuck it under him, because then when Shondi pulls it out on her side, it'll roll right out for her. Now I'm going between the middle of his back down towards his knees, because again, if we're using this as a lift sheet, we don't want it ending up way up towards his head. All right. And then last, I am going to put a blue pad here. He's had a little bit of incontinence today, and this will just make him feel a little more comfortable. That goes right on the draw sheet. And again, I'm just rolling it all in so that when Shondi rolls it out her way, it'll unroll just like bed linens. Okay, at this point, Mr. Jones, we're going to have you roll over. You've got a big bump to roll over, but I need you to come all the way to my side. Nice and easy. Yep, there's that bump. Let's put your leg out. We're going to put his leg up. And he's going to help me. Can you reach towards me? All right. Now, can you see how that's all rolled up? So all this contaminated linen, Shondi's rolling it all up, keeping it self-contained. And then she's going to take it to the linen cart. You bring the linen cart to your room. Don't walk down the hallway with it. That's totally against the rules. And again, you want to keep your uniform as clean as possible. Shondi's unrolling. Everything's unrolling really nice. Be sure you tuck it in tight. We want to get out all those wrinkles because again, we don't want to have any friction or pressure points on the patient's backside. Okay, Mr. Jones, we're going to lay on your back. Good. All right, now we're going to do the top sheets, and then last we do the pillowcase. And then when we step away from the bed, be thinking about those safety precautions. Again, you don't want to leave the bed in high Fowler's position, or Shondi and I have it at our waist right now. This is like a maze, trying to figure out how to undo this. Again, don't be going like this. All right, we're going to take that bath blanket out. Will you hold the top for me, Shondi? Thank you. Discard. Now at this point, I'm going to take these gloves off because I'm done with the dirty, and I'm going to go ahead and do hand hygiene. And then we're going to finish getting his beds all tucked in. And then lastly, we do the pillowcase. And we're going to do military corners. And again, just don't be flapping this around like it's a sheet in the wind. And when you put the, one more time, when we put these sheets on, you want the seams away from the patient's face. That's an old trick, but you don't want the seam to be rubbing on their face. Okay. Shondi's going to help me make some mitered corners. Okay. You want to do it together? Mm-hmm. You want me over there instead?
Sure.
Okay. This is the tricky part, are the mitered corners, but they're kind of fun because then you start doing them at home and you just do them for the rest of your life. So we're going to take the sheet and put it under. All right, this hangs down. All right. Now, the trick with mitered corners is a triangle. So you take the top and pull it up. See how I kind of have this triangle here? It kind of looks like a flag, an American flag triangle. And then it lays down flat, and I have another triangle here. Okay? This goes under. Nice and snug. And then this comes down. And what I do with this is I put my arm right here. And it just kind of helps it drape. All right? See the nice corner? Okay. And then we just finish straightening it up. Now the last thing, you want to kind of go like this. And just kind of pull up near the toes so that you're not squishing your patient's toes down because it's uncomfortable, it hurts. And if they have diabetes or something, you don't want that extra pressure on the toes. Okay? So he looks comfortable. And then we're just going to pull the sheet out because that goes on top, like that. All right. We're putting back in a safe position. Side rails go up. Bed goes down. We got to do our pillowcase. And then we'll make sure that he doesn't need anything else. Thank you, Shondi. Mm-hmm. That he doesn't need anything else. I'm going to just hold his head while we do that to provide support. Go ahead and ask him again if he has any pain, anything that you would do during your exit procedure, just to make sure, in case you need to come back, let him know about what time you'll come back. And that'll be it for this video. Thank you, everybody.